Hello, Dr. Mark Dailey here. Today we're going to talk about bacterial dysbiosis. Simply put, that means a disproportional amount of good to bad bacteria. Bacteria have no doubt gotten a bad rap in this day and age, and there are some bad bacteria out there. When we're talking about health, however, it's important to have balance. We're going to talk about the role of good bacteria and its impact or their impact on your health. And we're going to talk about bad bacteria and how they impact your health as well. One of the most important steps that you can take to improve your health, regardless of your current health situation and challenges, is to make sure that your intestines have plenty of friendly bacteria. Incredibly, you have more bacteria and other microorganisms living in your digestive system than you have cells in your entire body. These microorganisms total approximately 1 trillion and collectively weigh somewhere between 3 to 5 pounds in the average adult. Friendly bacteria in your gut do a number of things. For one, they stimulate the production of antibodies in your blood, increasing your immune system's strength and capacity to deal with toxins, allergens, harmful microorganisms, and incompletely digested proteins. They produce nutrients that are absolutely essential to your health, like vitamin B12 and vitamin K. They take up space and resources in your gut, which helps to prevent the infection of harmful bacteria, fungus, and parasites. They produce natural antibiotics, acids, hydrogen peroxide, which also helps protect you against infection by harmful microorganisms, including bacteria that can cause food poisoning, and they help you to digest food. You know that your skin is actually a barrier that helps to protect your blood and your inner organs against harmful materials in the environment. Your digestive pathway or your digestive system isn't any different. See, your mouth, esophagus, stomach, small intestines, and colon make up one long tube that acts like your skin to protect your blood and inner organs against harmful materials. In fact, the lining of your digestive pathway is continuous with your skin at your mouth and your anus, making your skin and the lining of your digestive pathway one continuous barrier that protects your blood and inner organs against harmful substances in the environment. Friendly bacteria are great helpers to the lining of your digestive pathway in preventing harmful substances and microorganisms in the food you eat and the air that you breathe from getting into your blood and causing damage to your organs. Having a large population of friendly bacteria in the digestive pathway has been shown to do a number of things. For one, it reduces and eliminates acne, eczema, psoriasis, food allergies, or food allergies related to hives and other skin conditions. It provides lasting protection against asthma, provides protection against food allergies, eliminating symptoms like joint pain, nasal congestion, snoring, ear infections, and itchy skin. It reduces or eliminates seasonal allergies like hay fever, improves digestion and normalizes bowel movements, significantly improves the strength of your immune system. So you might ask, how do bacteria reach the gut in the first place? Well, it starts as a baby. Your digestive pathway receives its first dose of bacteria from your mother's vaginal canal as you enter the world. If you were breastfed, and I hope you were, you received large quantities of bacteria from your mother's milk. Since you were a tiny infant, your digestive pathway has received bacteria every single day from air and food. Today, the balance between friendly bacteria and harmful microorganisms living in your gut is the result of all of your food and lifestyle choices. The healthier your choices, the more friendly bacteria you have living inside of you. An excellent source of friendly bacteria is healthy soil. No, I'm not asking you to eat dirt, but we are exposed to countless species of friendly bacteria when we're outdoors, playing and working in relatively unpolluted areas. Gardening and hiking in the woods are two of the best ways of exposing yourself to friendly bacteria on a regular basis. In fact, the best probiotic or friendly intestinal bacteria supplements that I know of were originally created with strands of bacteria that were found in healthy soil. Once you ensure steady exposure to friendly bacteria, it's important that you avoid or minimize the following most common causes of destroying friendly intestinal bacteria. Use of antibiotics without life-threatening or limb-threatening situations. Use of foods that are contaminated with antibiotics or antibiotic residues, which are mainly found in factory-farmed animal foods. Drinking chlorinated water. It's important to drink good, clean water, and I know we'll talk about that later in the program. Swimming in chlorinated pools. Eating foods and beverages that have sugar or other concentrated sweeteners. Regular consumption of refined and processed foods like cookies, chips, pastries, and prepackaged foods, which is basically our standard American diet. Regular consumption of alcohol, not chewing food until it's liquid, not learning to manage stress, which is a big deal in our busy lives. Use of steroids like prednisone and hydrocortisone. Use of antacids and other acid-inhibiting drugs. Use of laxatives. Use of birth control pills. So I hope you can see, or I hope you're starting to see, that bacterial dysbiosis is no small thing. Up to this point, we talked about the role of beneficial bacteria. What our next video, or in our next video, what our next video will cover is the role of bad bacteria, which are opportunistic and pathogenic bacteria. So hang in there. We'll see you on the next video. Thanks so much. God bless. Have a fabulous day.